I'm Amy Robach, a mother, journalist, an early breast cancer survivor, and your correspondent. Welcome back to Voices of More. Today, we're talking about something that can sometimes get wrapped up in worry, shame, and confusion: the risk of breast cancer coming back. But today's conversation is about reframing it, because understanding your personal risk isn't about living in fear, it is about living informed. Joining me today is Laurie. She has walked this road and is here to help others feel less alone as they face that uncertainty and to find the strength to move forward.
Thank you for having me.
Now, before we talk about breast cancer, I would like to know you as a person. Who are you, Laurie, outside of this diagnosis?
Let's see, I'm a big old nerd. I'm a major science fiction and fantasy fan. I am a partner. I am a mother. I have a 14-year-old son. I am a fundraising prospect researcher. And when I have the chance, I love to travel. I love musical theater.
We have a lot in common. I like a lot of those things too. When I received my diagnosis, I don't know about you, everyone has a different story. I broke down. What was your story upon getting the news?
So I was sitting alone in the living room, and I got the call, and they told me that it was cancer. And my mom was in the other room until my phone call was over, and then she came in and she looked at me, and I broke down. I sobbed on her shoulder for probably a good 10, 15 minutes, I think.
Nothing prepares you to hear that. And you go through so many emotions, from first learning that you've been diagnosed with cancer, and then you go through a whole other set of emotions when treatment ends. You have this feeling, what am I doing about it now? What if it comes back? That is the prevailing dark thought that tends to plague a lot of us. Did you have a moment like that?
I mean, every day I thought about it. Yeah, I could not stop thinking about what if it comes back and what are my chances of it coming back.
I know that after I finished treatment, I really wanted to understand what could come next. And when I started researching, I learned that early stage breast cancer, the risk of it returning is real. Within 3 years, up to about 1 in 9 people with stage 2 HR positive, HER2 negative disease, and up to 1 in 5 with stage 3 may see their cancer return. What helped you, Laurie, feel more in control of that uncertainty and your risk of recurrence?
So yeah, a lot of conversation with my team. I did a lot of reading online, a lot of research. You know, I'm a researcher by profession, so data is so important to me. It helped me feel more informed and more in control. I think a lot of people are probably anxious to just get it over with. You know, like we finished all of the first line treatment. I'm done. I don't want to do anymore. But I was not ready to be sort of let go.
Let's see what happens.
And see what happens, you know, release you into the wild. No. I'm not ready for that.
That's right. And you talked about how writing was such a huge part of your therapy, going through it, and how you processed your diagnosis initially.
Yeah, I write about that. I write about it all. I continue to, because you know my worries have not gone away. They've receded some, to be sure, but they're still there, and there are certain things that bring them back up to the surface, sometimes very unexpectedly. So it really helps me to make sense of everything when I write it down, and then it has the bonus effect of showing other people what it's like for at least one person to be going through this. I know everybody's experience is a little different.
I mean, the emotion of being able to connect and know that you can help someone who is maybe a year behind you or a couple years behind you, and you can help that person navigate decisions. When you do have certain emotions pop up, worry, anxiety, concern, do you have something you do, a go-to to calm yourself, to give yourself some perspective, to take a beat?
That can be a little hard because my brain is always sort of churning. But sometimes I manage to do things that allow me to not think. And for the thing that works best for me for that is water exercise, just being in the water. I sort of rediscovered the pool. That is the place where I probably feel most peaceful, is just being in the water, because I'm not thinking about anything else except where I am in that moment. It's nice.
Yeah. And that resonates with so many, I'm sure. After your diagnosis, we all think about our bodies are changing, we're getting older, we're dealing with gravity, we're dealing with slower metabolism rates, whatever you want to call it. But did how you view your body, did it shift?
For many, many years, I felt like I had sort of an adversarial relationship with my body. We can reframe how we relate to our physical selves. And one of the things that I've worked very hard on is just accepting my body for what it can do rather than berating it for what it can't. And that has really kind of turned things around for me emotionally about how I think about what my body has been through and what it is experiencing now. I made, this makes me a little teary, but I made a New Year's resolution this year, and I don't usually make those, but this year I decided that I was only going to speak lovingly to and about my body. And it's amazing what a perspective shift that is.
That's beautiful. I hope every woman heard that, because that is beautiful. Laurie, it has been incredible having this conversation with you. Obviously, it's clear you're in touch with your emotions and your feelings. It's been really powerful and really inspirational to talk to you today.
And thank you for the opportunity to share.
Oh,
I really
thank
appreciate
you.
it.
To hear more voices of strength and fortitude, visit voicesofmore.com, and please see important safety information at the end of this video.
What is KISQALI? KISQALI ribociclib is a prescription medicine used to treat adults with hormone receptor HR-positive human epidermal growth factor receptor 2 HER2-negative breast cancer in combination with an aromatase inhibitor for stage 2 and 3 early breast cancer with a high risk of coming back. If it has gotten worse or has spread to other parts of the body, advanced or metastatic breast cancer, in combination with an aromatase inhibitor as the first endocrine-based therapy, or fulvestrant as the first endocrine-based therapy, or following disease progression on endocrine therapy. It is not known if KISQALI is safe and effective in children. Important safety information. KISQALI may cause serious side effects, including lung problems. KISQALI may cause severe or life-threatening inflammation of the lungs during treatment that may lead to death. Tell your healthcare provider right away if you have any new or worsening symptoms, including trouble breathing or shortness of breath, cough with or without mucus, chest pain. Severe skin reactions. Tell your healthcare provider or get medical help right away if you get severe rash or rash that keeps getting worse, reddened skin, flu-like symptoms, skin pain or burning, blistering of the lips, eyes, or mouth, blisters on the skin or skin peeling, with or without fever. Heart rhythm problems, QT prolongation. KISQALI can cause a heart problem known as QT prolongation. This condition can cause an abnormal heartbeat and may lead to death. Your healthcare provider should check your heart and do blood tests before and during treatment with KISQALI. Tell your healthcare provider right away if you have a change in your heartbeat, a fast or irregular heartbeat, or if you feel dizzy or faint. Liver problems. KISQALI can cause serious liver problems. Your healthcare provider should do blood tests to check your liver before and during treatment with KISQALI. Tell your healthcare provider right away if you get any of the following signs and symptoms of liver problems: yellowing of your skin or the whites of your eyes, jaundice; dark or brown, tea-colored urine; feeling very tired; loss of appetite; pain on the upper right side of your stomach area, abdomen; bleeding or bruising more easily than normal; low white blood cell counts, neutropenia. Low white blood cell counts are very common during treatment with KISQALI and may result in infections that may be severe. Your healthcare provider should check your white blood cell counts before and during treatment with KISQALI. Tell your healthcare provider right away if you have signs and symptoms of low white blood cell counts or infections, such as fever and chills. Your healthcare provider may tell you to decrease your dose, temporarily stop, or completely stop taking KISQALI if you develop certain serious side effects during treatment with KISQALI. What should I tell my healthcare provider before taking KISQALI? Before you take KISQALI, tell your healthcare provider if you have any heart problems, including heart failure, irregular heartbeats, and QT prolongation, have ever had a heart attack, have a slow heartbeat, bradycardia, have high blood pressure that is not controlled, have decreased thyroid gland function, hypothyroidism, have problems with the amount of potassium, calcium, phosphorus, or magnesium in your blood, have fever, chills, or any other signs or symptoms of infection, have liver problems, have kidney problems, are pregnant or plan to become pregnant. KISQALI can harm your unborn baby. If you are able to become pregnant, your healthcare provider should do a pregnancy test before you start treatment with KISQALI. Females who are able to become pregnant and who take KISQALI should use effective birth control during treatment and for at least 3 weeks after the last dose of KISQALI. Talk to your healthcare provider about birth control methods that may be right for you during this time. If you become pregnant or think you are pregnant, tell your healthcare provider right away. Are breastfeeding or plan to breastfeed. It is not known if KISQALI passes into your breast milk. Do not breastfeed during treatment with KISQALI and for at least 3 weeks after the last dose of KISQALI. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. KISQALI and other medicines may affect each other, causing side effects. Know the medicines you take. Keep a list of them to show your healthcare provider or pharmacist when you get a new medicine. What should I avoid while taking KISQALI? Avoid eating grapefruit and avoid drinking grapefruit juice during treatment with KISQALI, since these may increase the amount of KISQALI in your blood. The most common side effects of KISQALI in people with early breast cancer include decreased white blood cell counts, decreased red blood cell counts, increased liver function tests, infections, increased kidney function test, decreased platelet counts, nausea, headache, tiredness. The most common side effects of KISQALI in people with advanced or metastatic breast cancer include decreased white blood cell counts, decreased red blood cell counts, increased liver function tests, infections, nausea, increased kidney function test, tiredness, decreased platelet counts, diarrhea, vomiting, headache, constipation, hair loss, cough, rash, back pain, low blood sugar level. KISQALI may cause fertility problems in males, which may affect your ability to father a child. Talk to your healthcare provider if this is a concern for you. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of KISQALI. For more information, ask your healthcare provider or pharmacist. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including patient information, at KISQALI.com.